I am Sue Wilson, and I am from Three Rivers Thermography, where our office is located in the North Hills of Pittsburgh. We've been here several times. How many of you have heard me speak here before? Or Judy? Have you? Yeah, I recognize you. Okay, that's awesome. I thank you for coming and listening. Today I'm going to do something a little different. I have talked about thermography before. Is there anybody that's not familiar with thermography at all? Couple people? Okay, what I'm going to do today is go through a very brief description of thermography and what it is. And then I'm going to talk about something that I got interested in because with thermography, it shows many conditions of the body. And one of the conditions that it's very good at showing is lymphatic congestion. So I got interested in that because people would call us after they got their thermographic report and they'd say, what do I do? It says that I have lymphatic congestion. What can I do? So we researched that a little bit and came up with something called dry skin brushing, and that's what we're going to show you today. I think you'll enjoy it because it's something very inexpensive. You just need a brush, and you can do it every day at home, and it will really help improve your immune system. So I'm going to get into that. I'm going to go through a very short segment here about thermography, and if anybody that hasn't been exposed to thermography wants to know more, I can give you information today and answer any questions. Okay? All right. So Judy's the owner. That's a picture of Judy there. She's not able to be here today, and that's our office in the North Hills. And from experience, I have been working with her since 2005. That's when we opened and brought thermography to Pittsburgh. I can tell you, hands down, if you ever have a scan with Judy or you've had a scan in the past, she's a great person to work with. She really cares about her people, and she will give you the attention that you need if you decide to have a scan, or you've already had one. You can probably attest to that. So Judy's a great person, brings lots of experience to the table, lots of medical background, and also she's very intuitive, which really helps in this field. Okay, so thermography. Our slogan is "We see it first," mainly because we like to look at our scan as very early detection. And it's a very good screening tool. It's a very good risk health assessment. Okay? We don't diagnose, but we can give you indications about what's going on in your body. This is kind of a picture of what a thermographic body would look like. We don't ever take the whole body like that. We take sections of the body at a time when we take our images. But that's what it gives you, a colorful image that looks like that. So we're looking for conditions, mostly inflammation in the body, and various different disorders. So why would you want to do a thermogram? Well, mainly because it's one of the scans out there that is non-invasive. So there's no radiation, there's no dyes injected into you. The camera, which is an infrared camera, does not touch the body. So the only thing you have to do is disrobe a little bit during the scan, and that's about as uncomfortable as we get. So it's completely 100% safe. And it also offers very early detection. It's different than other scans because other scans are looking at the anatomy of the body. So when you have an MRI, CAT scan, mammogram, they're actually looking at the tissue. Thermography never looks at tissue. You might say, well, what are you looking at then? What was that a picture of? That is a picture of heat that's radiating from your body. Okay? We don't see bones. We don't see skin. We don't see tissue. We don't see tumors. None of that. But what we're looking at is the heat that's radiating from your body that is specifically measured by the camera. So how does it work? Well, we have a little infrared camera that's set very specific for the human body temperatures. And this would be a typical breast image. And what the camera does is it measures the specific heat on your body. Then it puts it into a color scale. It attaches a color scale to that temperature. And that's why we get the pretty picture that we see here. So this is the scale. Depending on what temperature the camera reads, the purples, the greens, and the blues are the cooler temperatures on this lady. And then the warmer temperatures, the warmest being white, and then reds and oranges would be the warmer temperatures. Okay? So that's what we're looking at. Why is that important? Because it's looking at the physiology of the body, not the structure, but how is the body performing. And I'm going to get into that a little bit more in a second here. So here's some common things that thermography can pick up. Soft tissue injuries, pre-diabetes, dental disease in the mouth. Maybe you've had a root canal that it could be infected and you don't even know it because they've removed the root and you can't feel it. Sometimes unanswered pain. People have pain and they don't know why. Inflammation in the body. Of course, breast disease. It's great for early detection of any kind of breast disease. Lymphatic congestion like we're going to talk about today. Fibrocystic, estrogen dominance. All of those things. That's a picture of some lymphatic congestion with thermograms. So you see the warmth under the axilla. We know that we have lots of lymph nodes in the axilla. Okay, so when it picks up lymphatic congestion, that would be a typical picture of what we would see. So let me see here. What didn't I tell you? Okay, now one thing I want to say to you before I go on to talk about the dry brushing is the doctors know that the body is thermally symmetrical. Okay, so the right side of the body should look like the left side of the body on a thermogram. All right, it's like a butterfly. If they see imbalances with the temperature measurements, then that's an indication that there could be a possible problem. Okay, you know, an illness, an injury, something like that. So that's one thing they look for. They also look for change over time with a thermogram. A thermogram is like a thumbprint of yours. So once you have your baseline, it should not change, especially the breast tissue. Really should remain the same. If a woman comes in year after year, her pictures, she should be able to recognize them. They should really look the same to her. If they start to change, then that's an indication that there's metabolic change going on in the body. Remember we said we're not looking at structure, we're looking at how the body is performing. So if there are cells that are multiplying, okay, like in a possible breast cancer, you've got cells that are generating, they're abnormal cells and they keep multiplying. That's what the thermogram is going to pick up on because those cells are looking for a blood supply. So the body's sending blood there and those cells are you know, gaining in numbers and we see warmer temperatures. So that would be the second thing that the doctors would look for. And the third thing would be the patterns. So we have the body is like a butterfly, right to left should be the same, okay? And we also have different patterns that they pick up on. Obviously, you know that your hands are not as warm as your neck, right? So the doctors know, okay, there's certain areas of the body that are warmer than others, certain areas that are cooler. So they know when they're looking at the areas, you know, what it kind of should look like and also, you know, when there's a potential problem. So that really fast update of, go ahead, I'm sorry.
No, that's all right. As a general rule, heat bad, cool good, or?
Not really. That's right. Because in the case of, say, the thyroid, if they're looking at the function of the thyroid, if you have a cooler thyroid, that could indicate that it's sluggish and underactive. And it's the same thing with any of the organs in the body. So
it could go one way or the other?
that's exactly right. That's exactly right. Okay. Yes, if you have, you know, you're looking at both feet and one's very, very cold and the other is not. It can either be that maybe one, you have some kind of underlying infection in one or some kind of injury, or it could be that the other maybe has a lack of blood supply, maybe a beginning neuropathy, something like that. So it just depends on, you know, the symptoms of the client, the patient, and also what the doctors are looking at. So yeah, that's a great question. It's a great question. Any others before I, go ahead.
When you say doctors, do you mean doctors at your office, or does this go to a medical doctor?
Yes, it does. The doctors that we work with are trained, they're all MDs, and they're trained thermologists. So they go and have the training through the organization, and then they are able to read you know, your scan. So they write the report, and we give, you know, print that and give that to you. So that is yours. It comes right to you, and everybody, you know, gets a report.
And then you sit down with the individual to explain the report?
Well, what happens is when you have your scan, then before you leave, Judy will bring you up to the computer and show you your images. And you can, you know, ask any questions. She'll go over a brief overview of what you're looking at. So you have kind of an idea of what you know. Yes, exactly. And usually what she does is when the report comes back to us, she reviews it, and she will write on the letter that we send out with the report, you know, if you have any questions, call, or, you know, this looks like something we need to discuss, you know, and so forth. So yeah, she's available to answer any of your questions. Some people, you know, everything looks good, and sometimes she'll write that everything looks great, you know, if you have any questions, you know, so it just depends. Any others?
This picture here, does that, can you assess anything from that, or is that something the doctor has to look at and tell you what you're seeing?
Oh yeah, I mean, the doctors look at all of them. Judy's seen thousands of these, you know, so she's usually, you know, just because of her experience and reading all the thousands of reports that come back, she pretty much knows when something is of high risk or is low, you know, low risk. Usually something like this, you know, she would know. I don't know, but she would know whether it's something that needs to be addressed as, you know, lymphatic congestion or something maybe that is developing. And like I said before, your baseline is so important with a thermogram because, you know, if this lady looked like this, the first scan, and then looked like this on the second one, okay, well maybe something's going on, you know. And I can show you many, many pictures of how women have changed over time. It's incredible. It really is. So, any other great questions? Anything else? Okay. All right, well, we're going to go on. Like I said, I do have some brochures here, and, you know, I can send you things as well. If you have more questions after I leave, I can send articles out and everything, anything like that to explain thermography if you have any questions. So today, like I said, because we got this question all the time, what do I do about my lymph? I need to do something. My report says I have lymphatic congestion, so I thought, okay, let's help these people out. Like I said, I did the research, and we came up with dry skin brushing, which is a really simple technique that all of us can do at home. It takes about 5, 10, maybe 15 minutes a day, depending on how diligent you are. You can do a shorter version, you can do a longer version, it's completely up to you. But we're going to talk today about its health benefits and the technique. Okay, so we all know we have a circulatory system, right? Somebody says, what's your circulatory system? You're going to know that. You're going to know it's my arteries and my veins and my blood and my heart. And we're all very familiar with that. But what we don't talk about a lot of the time is that we have another system that helps transport the fluid in our body, and it's called the lymphatic system, and we just don't talk about it as much. So it runs parallel to the circulatory system. So this is an image of our lymphatic system, and it makes up, you can see all the green vessels are all lymphatic vessels. We have lymph fluid, and once the lymph is inside the vessel, it's called lymph fluid. We have lymph nodes, anywhere from 400 to 700 lymph nodes in our body. It's incredible, isn't it? When you think about 700, that's a lot. And then we have specialized lymphatic organs. So, first one would be the tonsils. They're the first defense against invaders entering through the mouth. Okay. Then we have the thymus. The thymus is where our T cells are matured, those cells that fight viruses and bacteria and harmful substances. Then we have our spleen, okay? So it's another filtration organ, filters the blood. And our appendix. Does anybody know what the purpose of the appendix, what the appendix does for us? Because I used to think it does nothing, right? Anybody?
The organ, it's a payment mechanism for the doctors. Yeah.
Good answer. Yeah, no. Yeah, really. We know that many people have had the appendix removed, and they've done a lot of research and found out since then that it really is an organ that's important in creating a good probiotic for the body. So it helps to generate the good flora that helps our colon stay healthy. And they just, overlooked that little thing before, but it's, nature's probiotic for our body. Okay, so that makes up the lymphatic system. Anybody see anything different about the lymphatic system that the circulatory system has? You notice anything different?
The circulatory system has a heart to pump it through, and the system doesn't.
True, no heart to pump it through. So we have a very slow, gentle wave with the lymphatic system. Okay, and I'll tell you a little bit more about that in a little bit, but anything else? You see the circle like the circulatory system? Nope, no circle. Lymph goes one way, back up towards the heart. That's it. So we'll show you how that works in a minute. Okay, very simply put, so that you can remember, the lymphatic system, if we were to compare it to a small city, it does three major things for our body. It removes the waste, so it's the garbage man, okay? So anything foreign that enters our body or is already in our body, viruses, bacteria, toxins, all that fun stuff, it's going to try to get it out, okay? That's one of the main jobs of the lymphatic system, which is also called the immune system. So they're interchangeable. It also provides the means to remove the waste. Okay, so the vessels are what the lymph travels through to get the waste out of the body. So it's our sewage system, basically. And it's also our policeman. It's going to keep us safe. So lymph nodes and lymph fluid is full of lymphocytes, or those cells that fight the germs and bacteria and all harmful things.
Where does the lymph fluid come from? Is it absorbed into the lymph vessels through the cells around?
The question was, where does the lymph node
Fluid come
come from? Good question. We're getting to that. Yep, let me get to that. And I'll answer that in one couple slides. Okay, so lymph doesn't have a heart. We established that already. We don't have a pump. So it has a couple different ways to move. One is through exercise. Okay, so exercise helps moving the body. The muscle contraction is actually what moves the lymph along, helps the lymph vessels to pump the fluid through. Deep breathing, okay, so the in and out of the chest helps the lymph to move. Dry brushing, which we're going to do today, dry skin brushing, and then there's also something called lymphatic drainage therapy, which is a type of massage, and I even hate to say massage with that because it's body work. It's really not like a massage. It's very, very different. So I am a massage therapist. I don't know if I said that. I am trained in lymphatic drainage 1, so I can do lymphatic drainage on people.
I just want to ask for a lymphatic
Sure.
drainage massage. Is it best to get someone certified?
If you have lymphedema, in a case where a woman, has lymphedema or swelling, yes, you have to have somebody certified work on you. I wouldn't work on you because what happens is the lymph reroutes, and you have to be trained to know when the lymph reroutes where it's going to go.
You mean like when it's displaced where it's shifting?
That's right. If it's displaced, if somebody's had some sort of serious surgery, you're right. You'd have to have a certified lymph practitioner. If you're healthy, and you don't have any kind of major contraindications, then yes, I could work on you. Yeah.
What about acupuncture?
Acupuncture for lymph movement. I haven't seen any research on that, and in my class they did not mention acupuncture as being something that's going to help them move the lymph. I think acupuncture probably is good for the immune system in general, Yeah. Okay, so you asked where lymph comes from, all right? So what happens, on the top here we have our arteries and our veins, okay? So our arteries, obviously at the end, we have very tiny, tiny, tiny capillaries, Okay, so the blood's flowing through, the fluid's flowing through, and at the end of the capillaries, some of the fluid seeps out through the walls into the interstitial space. So you see that little dot there? That's a little bit of fluid in the interstitial spaces. Okay, and some of it, continues on through the veins and goes back to the heart, but a lot of it seeps out. So we have a lot of interstitial space and a lot of fluid in that space. And you see down here in the green, those are the lymph vessels. Okay, so the lymph vessels are open-ended like a little cul-de-sac, and they've got a slight little movement with them. So they pick up that fluid in our interstitial spaces. Okay, and they eventually bring it back to where it needs to be. So we'll go through that in a little bit. But that's how it works. Any questions on that? Now what would happen if we didn't have the lymph pick up any of that fluid in the interstitial space? That's right, edema, terrible. I've read that between 24 and 48 hours we would be dead if our lymph was not functioning. So, because we would just, become highly toxic and blow up, basically. So, here's some benefits of dry skin brushing. Of course, we're improving our immune system. We're accelerating the filtration into the lymph vessels, filtering and cleansing and purifying. The lymph nodes are like tiny little filtration systems themselves. Okay, and they have lots of those lymphocytes in them. So definitely always fighting off invaders. So on the way back into the bloodstream or to the kidneys or to the spleen, the lymph goes through the lymph nodes and becomes filtered. Okay, so what we can use is dumped back into the bloodstream. What we can't use is excreted from the body. Okay. Let's see, so we're also detoxifying our skin, we're increasing our circulation, we're getting rid of the dead skin cells when we dry skin brush, which is always a good thing because the skin's always rejuvenating. It's going to improve our circulation. We're stimulating all those nerve endings on our skin. We have billions of sensory nerves on our skin, so we're stimulating those, okay? That's a great thing. It's going to relax us and rejuvenate us. And it will unimpede the chi flow. Now, some people think, this is woohoo stuff, chi flow, what's that? But actually, scientists have discovered that chi can be measured, okay? So it's our body's energy that runs through, and it can be measured like an electrical, system almost. So we all have our chi, and we all have energy that comes off of our body. Sometimes we have blockages in our chi, and dry skin brushing can unblock, okay? So if we look just at the skin itself, and these facts are, they're so interesting to me. The skin is the largest, the most important elimination organ, and is responsible for 1/4 of the body's detoxification each day. 1/4, that's amazing, the skin. Because we think detoxify, we think colon, right? We think kidneys. We don't usually think of our skin. And it says that it eliminates over 1 pound of acids, 1 pound of waste each day through our sweat glands. It's pretty cool. So when we're dry brushing, we're stimulating that skin to do its job better, okay? So it says it's the last to receive nutrients, yet the first to show signs, okay, of illness. So pay attention to your skin, always. It's giving you signs and signals of your inner health. Okay. Any questions on anything that we talked about? Lymph system?
If you do get a lymphatic massage, assuming your body's healthy, how long should the positive effects of that last? I mean, say you get it done 1 week, by the next week, should it still be pretty cleared up?
Well, like the body's it's constantly changing. It's constantly doing its job. So anytime you have any kind of therapy, I mean, I can't say exactly how long a lymph massage would last. I think it's very therapeutic, and you're going to jumpstart that lymph. Yeah, you're going to get it stimulated and moving. It depends on really your general health, I would say the answer to that is. So it depends on everything else that you're doing outside of that therapy as to how much of an effect it's going to have, you know. So if you're walking out the door and eating poorly, or, you know, not taking care of yourself, not ever exercising, then yeah. But I think you know, for most people, I mean, I can't really put a number on it, I don't think. The effects are startling, though. I mean, when in my experience and in my class as well, just working on each other, I couldn't believe, you know, how much we were feeling after just short sessions of lymphatic drainage.
How long should the session be?
It depends. You usually start out slowly and do one section of the body at a time. It's not like a massage where you do the full body. You just generally never do that.
Like a half an hour session usually?
Yeah, even it can be at the beginning of a massage, you can do 15 minutes and then go ahead and do the massage, you know. Something like that would be probably ideal. Yep.
I have questions about that, need for that too. I had cancer years ago and had like 22 lymph nodes removed in my arm. Now, does that mean that I should be doing extra stimulation? Like one thing I did, I never got edema, but I did the small trampoline bouncing.
Right.
They recommended.
Right.
And which I thought was wonderful. And I also have an exercise program and stuff, but would that also benefit, do you think?
The dry skin brushing
Well, that
or the massage. If anyone that has had cancer and lymph nodes removed needs to see a certified lymphatic drainage therapist. Absolutely. Absolutely. Because, and even with you today, I'd be leery of even doing this, because what happens is the lymph vessels will reroute. Lymph nodes never grow back, as you know. They don't. Unfortunately, once they're gone, they're gone. And the body, you know, has its pattern of where it's sending the fluid. So the lymph vessels are still there, but they have to reroute. And unless you have a trained, certified therapist, and I'm telling you, it's hours and hours and hours of training. So yeah, it really is to be certified. You can probably find them online. If you want to contact me, I can give you my information. You can contact me. I can find somebody for you. Yes, absolutely. I think it would be great for you. Yeah, I mean, because they have to be trained for lymphedema and that sort of thing. Because you don't want, you know, if somebody untrained works on you, and we're sending the lymph fluid where it doesn't want to go, that could actually make you worse. You know, it could actually cause a lymphedema.
Well, I notice if I'm fighting something, like a cold or sinus issues, I can feel those lymph nodes,
Right.
the ones that are there. I think they get overly full. That they
Possibly.
Get hard and
Yes.
they need work done.
Right.
Sometimes I think,
Right.
but I don't know.
Yeah, I would definitely recommend that for you, but make sure the person's certified. And like I said, I can help you with that. Okay? Yeah, this is, like I said, a good, very good thing to do if you are going through treatment, if you have, you know, even if you have bruised your leg and you have a cut, you know, don't ever do it over any kind of open wound or sores. Obviously, if you're getting the flu or you have a very bad cold, refrain from dry brushing. We want the body to go ahead and do what it naturally does. We don't want to make you feel worse, okay? So, but generally, for healthy people or, you know, in times when you're feeling great, this is a great, great technique. Yes,
I
sir.
understand that bouncing on a trampoline is excellent for the lymph system. Would that be prohibited with, like you said, with if there was already cancer in some of the lymph?
No, no, not really. That's not. Yeah, exercise would always be good, and the body's kind of, you know, a lot smarter than we are. You know, this is actually what she's talking about when you're doing the manual lymphatic drainage, where you have a therapist working on you. You know, they're actually guiding the tissue, guiding the fluid through the body. So You know, when a human gets involved, then it's a little different. And one other thing with the exercise, you know, we have lymphatic vessels. We have the superficial vessels, which is dry brushing. That's what we're going to affect. And I believe 70 to 80% of the lymphatic vessels are superficial, so they're right underneath the surface of the skin, okay? But then we have a few deep lymphatic vessels, and those are the ones that are mostly affected by exercise, okay? So, any other questions? You guys are good questions.
I'm similar to this lady. I had lymph node or lymph removed
Yes,
on the lower part of my body.
okay.
So I really shouldn't do.
You could do the upper, definitely could do the upper, yes. That would be safe because of the way the lymph flows and the patterns, you know. The lower body, for the most part, will drain into the inguinal area. Okay, so you would stay up above your belly button. Yes, ma'am.
How firm or how light should the brushing be?
Yep,
to not-
we're going to go over that. It's a great question. I'll go ahead and cover that now. Really, because the lymph vessels are so superficial, there's really no pressure at all. And it's the same thing with lymphatic drainage massage. It's the weight of a nickel, if you can imagine that. It's very, very light. So when you let your brush do the work, really, you don't press down at all. That's a good question.
If you press down too hard, is it because you're not moving any?
You're getting down to the fascia. You're not affecting the lymph anymore. Yeah, you're not going to hurt yourself, but you're not going to move the lymph, right? Any other? Okay, awesome. Here's what I'm going to do. Anybody who wants to do this with me, we can do, I'm going to give you a brush with a wrapper on it. If you want to purchase the brush and the instructions, they're $15. I mean, not much, and you can use it over and over again. If you don't want to do it and you just want to watch, that's fine. I'm going to demonstrate, okay? But anybody who wants to have a brush in their hand and practice it one time through, we're going to do that, okay? Now we're going to put this down here. Okay, so anybody would like to try it with a brush? Okay, that's fine. I'll take it back. Anybody else? Want to try? Yeah. Any fun? You guys back there? Nobody? Okay. Okay. Yeah, I need that back when we're done.
What is it? You can buy one?
Yes.
What is it for?
They're for dry brushing. That's what I'm going to show you here now. Dry skin brushing. Yeah.
I'll just buy one?
Yeah, you can buy one. Yeah. But that's through me. Yeah, it's not over here. It's through me.
I'll have to pay you?
Yeah, but when we're done.
Okay.
Yeah. 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 Okay. Sure. Okay. Good. Let's sit back. One more. Okay. Awesome. Okay. 15, and I'll give you the instructions with that too. So you can take what we're going to do up here. You can take home with you, in case you forget. Okay. Oops. Let me go back. Okay. So basically, people like to do this before a shower. There's no real rules. If you want to do it before bedtime, you can do that too. Sometimes it stimulates, so people like to do it in the morning. Before shower, you don't want to do it in the shower because once you add water, it changes everything with the skin. It's not the same friction, okay? So we want to do it dry. So that's why it's called dry skin brushing. So we're going to start, we're just going to do probably one side. So we lift our arms and we're going to go in a circular motion towards the outside in the armpit. So we're going to do about 7 circles in the armpit. And like I said, we're not pushing. We're letting the brush do the work. So you really don't have to push. It's almost like a little tickle, okay? So about 7 of those. Then we're going to do the chest. So you can leave your arm up. And we're going to start at the breastbone. And we're going to go out. We have lots of lymph nodes under the arm, and that's where we're pushing towards under our arm, okay? So about 7 times. Not now. Yep. So we're going from the chest out to the lymph nodes under the arm. These eventually come back to the heart. Yeah, it's the way the lymph. And then the same thing under the breast, around and up towards the axilla or armpit. Okay. So about 7 times like that. And then lateral side, we're going to reach up and come right up about 7 times. Okay. Now, if we're doing the actual breast tissue, and I say women, you know, that obviously have had breast cancers, like I said, I wouldn't recommend this. But the breast tissue itself, basically, we divide it into quadrants, okay? So the only quadrant that goes towards the heart is the upper inner quadrant, okay? So this area right on top of the breast, the inner, comes towards the heart. And then the rest of the breast tissue, so the outer quadrant upper goes this way, the lower goes towards the axilla again, and then the inside lower also towards the axilla. Okay, so that's a little tricky, but if you look at the arrows, you can see the only one going towards the heart is this upper inner. Okay, so it'd be the opposite on the other side. All right, so then we're going to do our back. So basically, I know you can't, I do have longer brushes. Somebody has trouble with that. So we have these available as well if you have trouble reaching. But basically, you're going to come from your spine out to the shoulder, as far down as you can reach. Okay, so it's just 5 or 6, 7 strokes towards the shoulder. And then we're going to start back here. Okay, and we're going to come forward to our clavicle. So here to the clavicle. And everything in the lymph basically will end up here. Okay, so all the lymph vessels in our whole body eventually ends up dumping back into the circulatory system right here at the clavicle. So we're going to come around that way, and then we're going to start on the cervical neck. Okay, we're going to go around our jawbone, and then once again down to the clavicle. So this one starts here, around the jawbone, down to the clavicle. Okay? And like I said, you'll have all these images if you want to buy a brush today. Okay, so the fingers. Basically, on the fingers, we can do a little back and forth motion. And then the hand, 7 times towards. You can do the palm as well. And then the wrist, it's a little back and forth stimulation. Okay. Now this is a little different, and this is very important because the sequence is important of how the lymph drains in the body. We want to do the upper arm first because if we push the lower arm here, and this is blocked, it's going to get stuck. Okay, so we're going to go ahead and drain the upper arm first now, and it's just an upward motion all the way around. And if you want to lift to do the back of the arm, okay, and then we're going to do the same with the lower arm all the way around to the elbow. Okay, great. All right, now we're going to do the groin area. Basically, we're going to start at the hip and come around. We're going to go towards the inguinal area, lots of lymph nodes in the inguinal area. Incidentally, most of our lymph nodes in our body, we said we had 400 to 700. They're in three major places. This would be one, the inguinal area. The armpit is the second, and the third is the neck. Okay, this triangle right here. So that's most of all the lymph nodes. Okay, so we're going to go in a little semicircle towards the groin on this side, and then you'll do the other side as well. And then the abdomen, we're going to start at our belly button, and we're going to do a circular pattern, bigger and bigger, bigger, and then stop when we get to our breast, obviously, and then big circles to little circles, back to the belly button. Okay? So, like a bullseye, out and back. Okay, now this picture looks like 2 different strokes, but it's actually one. So I'm going to show you here. You can start low or high, it doesn't matter, but if you start low, you're going to do one sweep here all the way around to the front. So I'll turn and show you what I'm doing. So I'm starting at the buttocks and going all the way to the inguinal area, and then I'm going to go a little higher on the buttocks and do the same sweeping motion, and then a little higher. Okay? So it's one stroke all the way around. And then the back. Okay, we're just going up, all the way around. Okay, so the foot has a specific 1, 2, 3, there are little numbers there, and if you want to do that, fine. I simply take the brush and just do little circles on the bottom of my feet. I start at the heel and just do little circles. And then of course the toes are like the hands, toes and feet. And then the ankle's the same as the wrist, around. And then once again, we're not going to do the lower leg, we're going to do the upper leg first, all the way around. And then we're going to do the lower leg all the way around. And that's it. So you can do 6 or 7 strokes, okay? Definitely dry. The sequence is very important because if you don't do the right sequence, then like I said, you could be backing up lymph even more. You know, you want to clear all the channels first. If there's a clog in your hose here and you run water through it, you know, it's going to stop. It doesn't matter if this is open or not. It's not going to go past the clog. So that's kind of what we're doing. We're opening the lymph channels closest to the heart first, working our way out. Yes?
What would be some examples of what makes the lymph clog? Would that be infections?
Lymph, it gets sluggish, you know. Why? Yeah, it just depends on general health. It depends on how much a person moves. It depends on, you know, if they have been sick and all those kind of factors. Yes, right, right. Yep, absolutely. So there can be a lot of factors, you know, and it's fluid in the body. And as we know, just like our circulation, we want to keep everything flowing in our body because the more we keep the fluid flowing, our bodies are, what, 60 to 70% water, okay? I believe 40% of that is lymph, of that 60%. Yeah, so you want to keep it flowing.
I've been doing reading about that, and they say that your lymph vessels, you could have circulating immune complexes that end up, like say you don't digest your food completely, some of the food goes through your intestine and circulates through your body, it could end up there. And then you have these bits of food, these circulating immune complexes, and that's getting stuck there and backing it up. They recommend taking bromelain because that'll help to digest that and get rid of that out of your body.
That's interesting.
Sometimes inflammation in the lymph vessel walls can back it up because I guess they're swelling and then you can't get through. And the other thing they said, some people don't realize it, but your veins and your arteries, that the integrity of the walls of the veins and the arteries aren't up to par, and they're just seeping out a lot more fluid, and then it's just too much, and it's getting, it can't possibly handle the load.
Yeah, that could be, yeah.
And then they say that things like, there's a number of herbs that will help.
Yeah, I have a couple up here in a minute. Yeah, that's a good point. I mean, and I think there's just so many factors, you know, with a person's health that can cause the lymph to be congested. So, yeah. Okay, so we have some foods that stimulate the lymph here. Very simple things that are in all of our stores now. If you think about it, you can add this to your diet very easily, a lot of these things. I mean, arugula, basil, cilantro, kale, how we all know about kale. There's so much written about it these days. But all these things can help stimulate the lymphatic system, so try to add those things to your diet. And these are some specific herbs that can help with stimulating the lymphatic. And I'm sure Dr. Weiner has products here specifically for stimulating the lymphatic. I know they have a liquid too that helps with that. What I just showed you here, you'll have them on the video, right? These lists? Yeah. And yeah, so, I mean, I can go back, I can leave it, and you want to write it too, I can do that. But those are common, you know. So, okay, so you can do dry brushing every day. I've had people tell me that they've seen, when they do it regularly, that they've seen a change in stool, a change in urine, and I've even had people tell me that their eye color changed. So, I don't know if that's possible, but, you know, keeping the body cleansed is so important, and I believe it could be possible. Wash your brush every week if you choose to buy one. You know, you're getting off all those dead skin cells, so just wash it with just soap and water and let it dry naturally. And like I said, there are some contraindications. Just, you know, use common sense, obviously. If you are sick, if you have some kind of condition, you know, refrain from dry brushing. Okay, we want the body to naturally do what it's supposed to do and not interfere too much. But other than that, it's fairly safe. Any other questions?
The pressure you were putting on is what you would do.
It's really not any pressure at all.
Right, very
It's just
light.
letting the brush touch your skin and letting the brush do the work, right? Because, like I said, the weight of a nickel, you know, if you press down the weight of a nickel, you're barely just making contact. Yeah. Right, because otherwise, under that, you'd be getting down into the fascia, and then you're not moving lymph anymore, you know.
I was told that the skin on my back of my hands is getting very thin. And somebody said to take I thought it was a tennis ball. Just some kind of a little small ball and they said even put it in olive oil. But do you think, will this stimulate even the skin?
It definitely stimulates the skin, right, because it's going to rejuvenate, it's going to, you know, anytime we're exfoliating, and that's basically what we're doing as far as that goes. Be careful though, because if your skin is very thin, okay, I mean, some women, you know, have told us that it can be a little uncomfortable, and I'm thinking maybe they're pressing, you know, you shouldn't really be pressing hard. But yeah, don't do it if it's uncomfortable, obviously, because that's your, yes?
Would it a time of day, like before shower, or?
Generally, that's what people do. Sometimes I've heard people tell me both, actually, because it's like a massage, because you're stimulating those nerve endings. Sometimes it can activate the parasympathetic. So you're, you know, that happy feeling you get after a massage. So it can be good before bed, but then I've also heard people have told me that it stimulates them, you know, that they kind of get energy from it. So I guess try it and see how it works for you, how it affects your body, and then, you know, do it accordingly. That'd be my best advice there, as everybody's different. Okay? All right, if you don't want the brush, we can put it back in the box. If you want the brush, I can give you the instructions, and you can, you know, let me know. You know what, I don't have the ability to do that today. I can you can take cash or check, or I can send you one, you know, send you that with the instructions.
If we buy the long and the short, would you give us a break?
Oh, yeah, give you a break. Yeah. So any other questions? Thank you so much. Yes, ma'am?
What is the cost of the whole test for the body?
The thermography, good question. The full body is $415. The upper body, which is the abdomen, the breast, and the head, is $280. The $245 for two, so if you just wanted to do, say, chest and abdomen or chest and head, would be $245, and then breast is $160. And I have brochures that have all the prices. Yep.
Right, because that's where I would really be.
Abdomen?
Right, well, lower because of having my
Right.
lymph removed.
Right.
With my circulation.
Right, and the lower body's considered one, so that would be one area, so that'd be 160, like if you're looking from the hip down.
And if you get those massages, do you buy them in a series? I mean, do they want to do like so many massages on them? Like,
You mean for the thermogram?
no,
Oh.
I mean the massage for the lymph. Is that
The massage, the lymph
just
massage,
get one? Is that good, or should you have a series of 8 or whatever it might be?
well, it depends on what you're trying to do. Like if in your case, you know, you would have to talk to your therapist to see what, you know, what plan that they would want for you, because everybody's different, yeah. Yeah, sometimes, you know, if you're coming in for just, you know, maybe you had an injury to your eye and you have, you know, swelling that keeps appearing or whatever. Maybe that's a weak area of the body. You know, sometimes one time can really do it. You can unclog and open that lymph and you're good to go. And then other times it might take a series. It just really depends. Yeah. Okay. All right. Thank you much, people. Any other questions? Thank you.